Hi, I'm Karan Thapar. Over the last few years, I hope you've been watching my program, The Interview on the Wire. During that period, I've interviewed doctors, politicians, businessmen, scientists, authors, and even the occasional Nobel laureate. For me, it's been exciting. I hope it's been enjoyable for you. But these, as you know, are tough times, and if this program is going to remain bold, independent, and sometimes even defiant, then I think we need your support. At the end of the day, it's a truism, but editorial independence is best defended by the viewers. So if you would like this program to remain the way it is, forthright, outspoken, and interesting, then would you consider supporting us? All you have to do is to click on the description at the bottom. But more than anything else, I hope you will continue to watch the interview. Your viewership means an awful lot to me. Thank you for your time. Goodbye. Hello and welcome to a special interview for The Wire. With COVID numbers rising once again, we ask, is this a matter of concern? And secondly, does India need an Omicron-specific vaccine? Those are two of several issues that I should raise today with Professor of Virology at the Christian Medical College in Vellore and a member of the government's COVID working group, Gagandeep Kang. Professor Kang, once again, COVID numbers are rising, and in fact, they've been doing so for a couple of weeks. Is this a matter of concern?
Not really. This is part of the pattern that we should expect to see, and we have been seeing it. For example, in southern India, the numbers went up a little before they went up in northern India. But nobody is getting very, very sick if they don't have other risk factors. So I think this is the shape of things to come.
In which case, how would you describe the present situation? Are we at the onset of a fourth wave, as some people have suggested, or is that an exaggerated or at least an inappropriate description?
I think what we will see is surges and declines that will vary by geography in the future. It's very unlikely that unless we have a significantly different variant, not a sub-variant of Omicron, that we will see a fourth wave. I definitely do not think that this is the start of a fourth wave.
It's been reported that somewhere between 60 to 80% of the cases are of the BA 2.75 variant. Would you agree that at the moment, that looks like the dominant variant in India?
Oh, absolutely. And it's been dominant for a few weeks now. And this, again, is something that we should expect. This is a variant that has surged in India. It's also been detected in over 20 other countries, but it is the largest single circulating variant in our country at this time.
Let's then talk a little about BA 2.75. It's said to be more transmissible than BA 4 and BA 5 and considerably more transmissible than the original Omicron variant. Would you agree with that view?
Yes, it does seem to be more transmissible, which means that it has a certain level of immune escape. It also has a shorter incubation period than many of the variants that we've seen previously, and both of these lead to its ability to spread easily between people.
Now, the question that I suppose worries the audience is the question, how serious is the disease that BA 2.75 can cause? At the moment, over the last 10 days or so, hospital admissions and deaths have risen, but they're nowhere near levels that would cause concern. Is that proof, if the word proof is the right one, that BA 2.75 doesn't cause serious or worrying illness?
Well, all severe disease, all hospitalizations, all deaths are the apex of a pyramid. And that pyramid has a very, very broad base. In the case of Omicron and in the case of BA 2.75, that broad base will have started early with infections and with some amount of symptomatic disease. And then after a while, that results in the lagging indicators of hospitalizations and deaths. That's what we are seeing. Hospitalizations are not going up very markedly. And mostly hospitalizations and deaths continue to occur in people who have other comorbidities, are elderly, or are unvaccinated. This is a pattern that has established itself since last year and is repeating with each new subvariant that we see.
Now, BA 2.75 can both infect people who've had previous infections as well as people who are fully vaccinated and boosted. You hinted at this earlier, but I thought I'd ask you up front. Does this mean that it can escape immune response far more effectively than the other earlier Omicron variants?
So BA 2.75, based on laboratory studies, at least seems to have slightly less immune escape than BA4 and BA5. But these are all subvariants of Omicron. This is Omicron putting out new little branches. And immune escape with Omicron was something that we recognized last year, and it's continued to be seen in the subvariant. Each variant that needs to establish itself in the population needs to be a little bit better at infecting people. And the way that it can happen in a largely vaccinated, largely infected population is by being slightly better at immune escape. But this is not a variant that has completely escaped immunity. We are not seeing severe disease with this variant in the bulk of cases. And in fact, some of the antibody cocktails that are available for prevention or treatment of infections are continuing to work, even for BA 2.75. Those are not currently available in India, but they are available in other parts of the world and are a demonstration that we can have tools even against this variant.
Before I pick up on some of the things you said in that answer, particularly with regard to how effective vaccines are against BA 2.75, can I just ask a layman's question? Would I be right in saying that BA 2.75, which is the dominant variant in India at the moment, is not as virulent and it's not leading to the sort of disease that we saw last year with Delta or earlier with Alpha? This is a much milder variant. I know this is a layman's question, but it's the sort of thing that would reassure audiences, which is why I've asked it.
You're absolutely correct. We are not seeing the levels of severe involvement that we saw with Delta or Alpha or the ancestral variant.
Let's then come to how effective are our vaccines against not just Omicron, but this particular variant that is spreading at the moment in the country, BA 2.75. And I'm talking particularly about Covishield and Covaxin, because those are the vaccines that pretty close to 95% of the people have had.
So we don't know specifically for BA 2.75. Most of our data on effectiveness of vaccines comes from the series of studies that have been done in other parts of the world, where the effectiveness of specific vaccines against specific variants has been documented and communicated to the rest of the world. As I've often said before, in India, despite the fact that we have electronic systems that track our testing, that track our vaccination, we have been unable to link them together at scale to get effectiveness data in India for the vaccines that are being used in India. Since the UK does not at the moment have BA 2.75 as its dominant variant, and in any case, their vaccination program is now a combination of different kinds of vaccines heavily reliant on the mRNA approach, there is no primary data that we can rely on to say that the vaccines are working. Nonetheless, given the circumstances that we are living in India today, we know that in our highly vaccinated, highly infected population, we are not seeing the outcomes of a failure of vaccines. By inference, the vaccines are continuing to work.
Can I pick up on something you said at the beginning of that answer? That we don't specifically know whether our vaccines, Covishield and Covaxin, are effective against BA 2.75. Now, is that because we don't know how to find out? Or is it because we haven't bothered to take the steps to find out? Which of the two?
We know how to find this out. There is a design which is called the test negative design, essentially like doing case control studies, which we have done for other vaccines in the past. But what you need to be able to inform these studies is data linked to the individual patient. If a person gets hospitalized, is symptomatic, or is infected, did they receive vaccine? If yes, which vaccine and when? And that information, if we have on a series of patients, we can calculate the effectiveness of the vaccine and the effectiveness of vaccines over time. Unfortunately, we have not been able to link the testing data with the vaccination data so far. And that means that we can't interpret our situation based on data. That's why I said I'm inferring that the vaccines are working. I cannot base it on available data at this time.
But you've said a very important thing. First, we know how to check whether our vaccines are effective. We've done that for other vaccines in the past. What we need is the data. And more importantly, we need to interlink the data. I presume that data is available. It would be bizarre and deeply worrying if it's not. It's just that it hasn't been interlinked. And if that is the case, that the problem is the data is available, but it hasn't been interlinked, then doesn't that suggest a certain measure of casualness or even irresponsibility? Because it's in our interest to know.
I think the priority was to get people vaccinated and to document what was happening in terms of vaccination. And that has worked really, really well. But I think it's very important to emphasize to the government and to the scientific community that COVID-19 is not a problem that is going to go away. There are going to be new variants that will emerge in the past. The requirement for deciding when to vaccinate the population, give precautionary or booster doses, and with which vaccine, those decisions are going to need to be made based on data, because we can no longer rely on global data to tell us what to do with our population. So I think even if we start today with linking data, that will be tremendously helpful for all of us.
There's a clear message there to the government. Even if we start today with linking data, it will be tremendously helpful to all of us. In other words, this is what the government should do and needs to do, and hopefully they will hear you and do it. Meanwhile, let me ask you this. Do we need, I'm talking about us in India, do we need an Omicron-specific vaccine?
Well, all the data that we've seen so far is that now with a vaccinated and infected population, any additional doses of vaccine are going to have some level of incremental benefit. It's not the stonking protection that we got with the primary immunization that we gave. Now, does broadening the number of proteins or sequences you have in a vaccine really help you protect specifically against that time, against a specific type of virus? And the data that we have from Moderna and Pfizer that have made Omicron-based vaccines is that there is a marginal incremental benefit. Does that mean we should stop making vaccines, or does it tell us that we absolutely need to make vaccines? I think the answer is somewhere in the middle. For the science, it's really good for us to know how to make multivalent vaccines. We recognize that the protection may be incremental and may vary by the infection history of the person that has received that particular multivalent vaccine. But I also think that this is good preparation for any future variants that might emerge where we might want to make and license vaccines quickly.
I note that you said that the additional protection from a Omicron or any other variant-specific vaccine is incremental. However, incremental protection could be critical for categories of people who are either elderly and therefore vulnerable or have comorbidities and are therefore vulnerable. So speaking specifically about just those two categories, should India acquire the Moderna Omicron-specific vaccine or the Pfizer one just for these two categories? Because for them, the incremental increase in protection could be critical.
So in the UK, the decision has been made and they have licensed the Moderna bivalent vaccine that also has Omicron in it. And that's what they are planning to use for their population for protection during the coming winter. Now, in India, we don't currently have bivalent vaccines, and the issue of indemnity with the Moderna vaccine, I presume, will still apply. Nonetheless, I think for the Indian vaccine industry to think about making its own bivalent vaccines is something to be considered. For immediate protection of our populations, well, I think in the case of the public sector, we really need to understand what the costs versus the benefits might be if we were to import the Moderna vaccine. Our population structures are very different, and we may find that that incremental benefit is not worthwhile for us as an investment in public health terms. But in the private sector, I think if people want to take any specific type of vaccine because they believe that that will give them slightly better protection, I think there's really no problem with opening up private sector vaccination with a range of vaccines.
That's a very clear answer. Clearly, this is an issue the government needs to think about carefully, particularly with regard to the public sector. It needs to assiduously evaluate the benefit against the cost and whether the incremental benefit at that particular cost is worth it or not. Let me come, because we're coming to the end. In the present circumstances, given the level of vaccination in the country, given the nature of BA 2.75, do we need more stringent mask wearing? Perhaps go back to hand sanitation?
I think masking now is a question of your individual perception of risk and your desire to protect yourself. So with anybody who is vulnerable for age or disease reasons, I would advise them to wear the best quality masks they can when they move around with into unfamiliar environments with unfamiliar people. But I think for the general population, given our histories of exposure and of vaccination, it probably does not make sense to wear a mask in every situation. Obviously, if you're going to be traveling in a crowded bus and don't particularly want to acquire a respiratory infection, and that does not need to be SARS-CoV-2, it could be flu as well, you would wear a mask. We know they work.
Okay. Once again, it's as far as the general population is concerned, that's the vast majority of us, it's a decision that you believe every individual must take, but it doesn't make sense, you said, to wear a mask in every situation. Perhaps when you're in a crowded bus, And by the way, as you pointed out, masks can protect not just against COVID, but also against flu. Finally, literally, we're at the end. I discovered that only 18.2% of the population over the age of either 18 or 15 has actually taken their booster. How do we get that up to a higher percentage?
I think better education. At the time that the booster started, which was in January with Omicron, by the time you got vaccinated, the Omicron wave was over. So it's very unlikely that the boosting resulted in a lot of protection against Omicron. But now we are coming to a stage where the bulk of people are a year or more out from having received their primary immunization, and we are coming up to winter. So if you're vulnerable at this time, it's still, and you haven't been vaccinated, it makes sense to get vaccinated. For a younger and healthier population, that I think is still a question of risk versus benefit, particularly in public health terms. So, at an individual level, yes, obviously that incremental protection is worthwhile. But in public health terms, I think we are at the stage where we need to weigh different interventions for different diseases and decide where the best place to invest our rupees really is.
In other words, the time has come not to focus single-mindedly on COVID and COVID vaccination, but to be equally concerned about other diseases that could affect the population. We've moved to a different level of concern about COVID. That is the case, isn't it?
Absolutely.
Thank you very much indeed, Professor Kang. I'll end by repeating what you said in your very first answer when I asked you how concerning is the present rise in COVID numbers, and your answer was not really. It's part of a pattern we should expect to see. We will see surges and declines from place to place, varying by geography. In other words, this is what we must expect for the foreseeable future and learn to live with it, both physically and mentally. Thank you very much indeed for your time. Take care.
Thank you.
Hi, I'm Karan Thapar. Over the last few years, I hope you've been watching my program, The Interview on the Wire. During that period, I've interviewed doctors, politicians, businessmen, scientists, authors, and even the occasional Nobel laureate. For me, it's been exciting. I hope it's been enjoyable for you. But these, as you know, are tough times. And if this program is going to remain bold, independent, and sometimes even defiant, then I think we need your support. At the end of the day, it's a truism, but editorial independence is best defended by the viewers. So if you would like this program to remain the way it is, forthright, outspoken, and interesting, then would you consider supporting us? All you have to do is to click on the description at the bottom. But more than anything else, I hope you will continue to watch the interview. Your viewership means an awful lot to me. Thank you for your time. Goodbye.